Recent medical research shows that 7 out of 10 seniors who follow these simple steps can significantly reduce acid reflux and heartburn symptoms. As we age, managing these discomforts becomes more crucial for enjoying life to the fullest. Heartburn can often interfere with your comfort, especially during mealtime. By paying attention to lifestyle changes and health practices, you can ease symptoms and improve your quality of life. Let's explore practical, evidence-based guidance on managing acid reflux effectively. Together, we'll embark on a journey to enhance your well-being and comfort. Understanding acid reflux is the first step to managing it. Acid reflux occurs when stomach acid flows back into the esophagus, causing irritation. Think of your stomach as a bottle with a loose cap. When tipped, contents spills out. In this case, stomach acid can irritate the esophagus, leading to heartburn. Factors such as certain foods, medications, or lifestyle habits can exacerbate this condition. Educating yourself about these factors can help in minimizing episodes. Being informed empowers you to make changes that support your digestive health smoothly. Recognizing the signs of acid reflux is key to timely management. Common symptoms include a burning sensation in the chest, regurgitation of food or sour liquid, and difficulty swallowing. These symptoms often worsen after eating or lying down, making it important to pay attention to when they occur. If you experience persistent discomfort, it's essential to consult with your healthcare provider. Awareness of these symptoms can help you take early steps to alleviate discomfort and prevent possible complications. Remember, listening to your body is vital in maintaining health. Diet plays a significant role in managing acid reflux. Eating smaller, more frequent meals can mitigate symptoms. Foods like bananas, oatmeal, and lean poultry can be gentle on your stomach. Avoid trigger foods such as spicy dishes, citrus, chocolate, and caffeine. Timing is also crucial. Try not to eat within 3 hours before bedtime to reduce nighttime symptoms. Consider preparing meals that are easy to digest and using methods like baking or steaming. These small adjustments to your eating habits can significantly enhance your comfort and digestive health. Engaging in regular, safe movement benefits overall digestive health. Simple activities such as walking after meals can aid digestion and reduce acid reflux episodes. Gentle exercises like seated stretches or Tai Chi can also improve your well-being without straining your body. Remember to go at your own pace and consult with a healthcare professional before starting any new exercise regime. These activities not only enhance physical health, but also promote mental relaxation. Staying active is a powerful tool in managing symptoms effectively while enjoying the benefits of an active lifestyle. Regular medical monitoring is crucial for managing acid reflux effectively. Schedule regular checkups with your healthcare provider to discuss your symptoms and treatment options. Your doctor may recommend medications or other interventions to help control acid production. It's important to understand when to seek immediate medical attention, especially if experiencing severe pain or difficulty swallowing. Working closely with your healthcare team ensures that your treatment plan is tailored to your needs. Together, you can navigate your health journey with a proactive and informed approach. Acid reflux can impact not just physical health, but also emotional well-being. It's important to remain positive and connected with friends and family. Join social groups or participate in community activities to sustain relationships. Practicing relaxation techniques such as meditation or breathing exercises can alleviate stress, which often exacerbates symptoms. Remember, your mental health is as important as physical health. By nurturing your social connections and maintaining a positive outlook, you can manage the emotional impacts of acid reflux, achieving a balanced, fulfilling life. Recapping what we've learned, managing acid reflux involves understanding the condition, recognizing symptoms, making dietary adjustments, and staying active. Regular medical consultations and a focus on mental well-being complete this comprehensive approach. Start today by implementing these small changes and consult with your healthcare provider to tailor strategies to your personal needs. Remember, you have the power to influence your health journey. Making informed choices today can lead to a healthier, more comfortable future. Together, let's embrace the possibilities of better health.